Okay, so imagine you're going about your day, right?
Mm.
And you're feeling fine,
Mm-hmm.
and then, bam, stroke.
Yeah.
It can happen that fast.
Oh, yeah.
And the impact is often life-changing. But
Absolutely.
what if I told you that up to 80% of strokes are preventable?
Wow.
That's right.
That's
You have
amazing.
the power to significantly reduce your risk.
Really?
We are diving deep today into the 2024 guideline for the primary prevention of stroke.
Okay.
It's a roadmap to protecting your brain health from the American Heart Association and American Stroke Association.
Wow.
This isn't just dry medical jargon.
Yeah.
It's packed with actionable insights based on the latest research.
Awesome.
And a huge thanks to the London Heartbeats Z Academy in the UK for giving us the material to bring you this deep dive.
Oh, wonderful.
If you're finding this deep dive helpful, make sure you subscribe to our podcast on platforms like Facebook, Instagram, Spotify, and YouTube.
Right.
We release new episodes regularly, and you won't want to miss out. Now, the 2024 guideline tackles a problem you might not even realize exists.
Yeah.
The prevention gap.
Okay.
It's the difference between knowing how to prevent strokes and actually doing it.
Right.
But don't worry, this deep dive is all about bridging that gap and giving you the knowledge to take control of your brain health.
That's great.
I'm thrilled to have our expert here today to help us navigate this critical guideline.
So what's exciting is that this guideline doesn't just preach about healthy living.
Okay.
It digs deep into the science behind prevention. It's like having a team of researchers whispering the secrets to a longer, healthier life directly into your ear.
Okay, that's a pretty cool image.
Yeah.
So where do we even begin? I'm seeing Life's Essential 8 mentioned everywhere. Is this like the holy grail of stroke prevention?
You could say that Life's Essential 8 are the key areas the guideline pinpoints as having the most significant impact on your cardiovascular and brain health. We're talking about eating better, being more active, quitting tobacco, getting healthy sleep, managing weight, controlling cholesterol, managing blood sugar, and managing blood pressure.
Okay, so it's a holistic approach.
Yeah.
But are all 8 factors equally important?
Right.
Or are some more crucial when it comes to preventing strokes specifically?
That's a great question.
Yeah.
While all 8 contribute to overall well-being, the guideline highlights blood pressure management as the absolute MVP.
Oh, no.
They emphasize that most people with hypertension will likely need 2 or more medications to hit their target blood pressure.
Wow.
It's not just about popping a pill.
Right.
It's about working with your doctor to find the right combination and making those lifestyle tweaks to support your medication.
Right. It's a team effort.
Exactly.
And speaking of teams, the guideline also acknowledges that healthcare isn't just about biology. It's about social determinants of health, right?
That's right.
Can you unpack that a bit for us?
Sure.
Yeah.
It's about recognizing that things like access to healthcare, healthy food options, and even your environment play a huge role in your health outcomes. It's like trying to run a marathon with one shoe untied.
Yeah.
You might be able to do it, but it's going to be a lot harder.
Right.
The guideline recommends screenings for these social determinants to ensure everyone has a fair shot at preventing stroke.
That's really important, especially since we know that strokes disproportionately affect certain communities.
Definitely.
Okay, let's get down to brass tacks here.
Okay.
The guideline has a whole section on diet.
Right.
What's the big takeaway there?
Hold on to your hats because the guideline goes beyond the usual eat your veggies advice.
Yeah.
They specifically champion the Mediterranean diet,
Yeah.
especially when boosted with nuts and olive oil.
Okay.
And get this, they actually analyzed multiple studies and found that low-fat diets don't really move the needle when it comes to stroke reduction.
Okay, so it's not about deprivation. It's about choosing foods that nourish your body and brain. Pass the hummus, please.
Right.
Are there any other dietary nuggets we should know about?
Yeah, the guideline also highlights the potential of B-complex vitamins in reducing stroke risk.
Okay.
Think of these vitamins as tiny superheroes, helping to keep your blood vessels healthy and your brain functioning optimally.
Love it.
Yeah.
Now let's talk about something a little less delicious: exercise. I know.
I know.
But the guideline doesn't let us off the hook here, does it?
It doesn't.
What's the deal with physical activity and stroke prevention?
Well, the good news is it's not about becoming a marathon runner overnight.
Okay.
The key is finding something you enjoy and doing it regularly.
Right.
The guideline even acknowledges those of us who are glued to our desks all day.
Yeah.
They recommend screenings for prolonged sedentary behavior and suggest incorporating movement breaks throughout your day.
So it's about being mindful of how much we're sitting and finding ways to sneak in more movement, even if it's just a quick walk around the office or some stretches at our desks. Every little bit counts.
Every little bit.
Speaking of small changes, did you know that simply taking a daily aspirin was once thought to be a magic bullet for stroke prevention?
Oh, yeah, I remember that.
Yeah, I remember hearing that.
Yeah.
But is it true? What do the guidelines say about aspirin?
This is where things get interesting.
Okay.
The guideline actually dives deep into the latest research on aspirin and finds that it's not as straightforward as we once thought.
Okay.
Turns out the benefits of aspirin need to be weighed against the potential risks, particularly bleeding.
Okay.
It's not a blanket recommendation anymore. It's about personalized decision-making with your doctor.
Wow. So even something as seemingly simple as taking an aspirin requires a nuanced approach.
Yeah.
I'm already starting to see how this guideline emphasizes individual care.
Absolutely.
If you were just joining us, you were listening to The Deep Dive, and today we are going deep into the 2024 guideline for the primary prevention of stroke. Don't forget to subscribe on platforms like Facebook, Instagram, Spotify, and YouTube so you don't miss out on future deep dives like this one.
Right.
Now, before we move on to the next section, huge thank you again to London Heartbeat's Z Academy in the UK for providing the educational material for this deep dive.
That's fantastic.
Their commitment to stroke prevention is truly making a difference.
Amazing.
We'll be right back after a short break to continue exploring the fascinating world of stroke prevention.
Okay.
Stay tuned.
That sounds good. Welcome back to our deep dive into the fascinating world of stroke prevention. We're unpacking the 2024 guideline, and there's so much more to explore.
One thing that's really struck me is how this guideline doesn't shy away from addressing stroke prevention in specific populations. It's like they're saying, hey, we see you, and we've got specific recommendations just for you.
Absolutely. And one group that often faces unique challenges when it comes to stroke prevention is people with sickle cell disease. This condition affects red blood cells, and the guideline highlights its potential to increase stroke risk, especially in children.
That's heartbreaking. So what can be done to protect these kids?
Early detection is key. The guideline strongly recommends regular transcranial Doppler ultrasound screenings for children with sickle cell disease.
Okay.
It's like having a window into their brain's blood flow, allowing doctors to spot any potential problems before they escalate. And for those identified as high-risk interventions like blood transfusions, can significantly reduce their chances of having a stroke.
That's incredible. It's like science giving these kids a fighting chance. And speaking of fighting chances, the guideline also dives into stroke prevention for individuals with genetic stroke syndromes, right?
Yes. It emphasizes the importance of knowing your family history and understanding your genetic predispositions. It's like having a secret decoder ring for your health, helping you and your doctor anticipate potential risks and tailor your prevention strategies accordingly.
It's like personalized medicine in action. Now, I'm really curious about the section on transgender individuals. This is a population that's often underrepresented in medical research, so it's great to see the guideline addressing their specific needs.
It's a huge step forward. The guideline stresses the importance of culturally competent care for transgender individuals, recognizing that their healthcare journeys can be complex. They specifically address the potential impact of hormone therapy on stroke risk and provide tailored guidance for navigating those waters safely.
That's so important. It's about creating a healthcare system that's inclusive and responsive to the unique needs of every individual. What about people with coagulation and inflammatory disorders? How does the guideline address stroke prevention for them?
These individuals are at a higher risk of stroke due to their underlying conditions. The guideline takes a personalized approach, recommending individual risk assessments and recognizing that stroke prevention strategies might need to be adjusted based on their specific situations. It's not a one-size-fits-all approach. It's about finding what works best for each person.
It's like a tailor-made suit for your health.
Yeah.
Okay, let's talk about a sensitive but crucial topic, substance use disorders. How does the guideline approach stroke prevention in this context?
It acknowledges the delicate balance between addressing substance use and preventing stroke. They recommend screenings for substance use disorders and offer counseling to those who are at risk. The key is to integrate stroke prevention strategies into overall substance use treatment plans, creating a holistic approach to well-being.
It's about recognizing that addiction is a complex issue and that treating it effectively can have positive ripple effects on other aspects of a person's health, including stroke prevention.
Now, shifting gears a bit, the guideline also delves into the connection between heart health and stroke prevention, right?
Absolutely. It highlights specific heart conditions like atrial cardiopathy and left ventricular dysfunction as important risk factors to consider.
Okay, those sound like pretty technical terms. Can you break them down for us non-medical folks?
Think of your heart as a house with 4 rooms. Atrial cardiopathy is like having some wonky walls in the top 2 rooms, the atria. This can make blood flow a bit sluggish, increasing the risk of clots forming, which can then travel to the brain and cause a stroke. Oh, I get it now. So it's not just about having a strong heart, it's about having a heart that's working smoothly and efficiently. What about left ventricular dysfunction? What's going on there?
Left ventricular dysfunction is like having a weak pump in the main pumping chamber of your heart, the left ventricle. This can lead to fluid buildup in the lungs and other parts of the body, putting extra strain on your system and increasing your risk of various health problems, including stroke.
So taking care of our hearts is essentially taking care of our brains. It's all interconnected. Now, the guideline also dedicates a section to preventing stroke in pregnant individuals. That's so important. What are some key takeaways from that section?
It highlights the unique physiological changes and potential complications that can arise during pregnancy and postpartum. They stress the importance of managing high blood pressure as it can significantly increase stroke risk during this time. It's like giving extra TLC to your heart and blood vessels during this critical period.
It makes sense that pregnancy would put extra demands on the body. So it's about being extra vigilant and working closely with your healthcare provider to ensure both mom and baby stay healthy. What about other reproductive health factors? Does the guideline cover those too?
Yes, it delves into conditions like endometriosis, highlighting its potential link to stroke risk. It also provides recommendations for navigating menopause safely and addresses the potential impact of exogenous testosterone use on stroke risk in men.
Wow, it really covers the spectrum of reproductive health. It's refreshing to see a guideline that takes such a comprehensive and inclusive approach. Remember, we are exploring the 2024 guideline for the primary prevention of stroke, and there's still so much to uncover. If you're enjoying this deep dive, don't forget to subscribe on social media platforms like Facebook, Instagram, Spotify, and YouTube. You'll get free regular updates and won't miss out on any future discussions like this one. Stay tuned as we continue our journey into the world of stroke prevention. We'll be right back with more insights and actionable tips. Welcome back to the deep dive. We're wrapping up our exploration of the 2024 guideline for the primary prevention of stroke, and I have to say I'm feeling pretty empowered. It's like we've been given a secret weapon against this potentially devastating condition.
Knowledge is definitely power, and this guideline is packed with it. It's amazing how much research has gone into understanding stroke risk and developing effective prevention strategies.
You know, one thing that keeps coming up is this idea of personalized care. It's like the guideline is saying, hey, we're not going to give you a cookie-cutter approach. We're going to help you figure out what works best for you.
Absolutely. The guideline moves away from the one-size-fits-all model and emphasizes tailoring prevention strategies to each individual's unique risk factors, medical history, and lifestyle. It's about working collaboratively with your doctor to create a plan that fits your life, not forcing your life to fit a plan.
It's like having a health coach in your corner, cheering you on and guiding you every step of the way. Now, earlier we talked about aspirin and how its role in stroke prevention is more nuanced than we once thought. The guideline also dives deep into the use of other antiplatelet medications, right?
Yes, it explores medications like clopidogrel and ticagrelor, especially for individuals who can't tolerate aspirin or have specific conditions where these alternatives might be more appropriate. They even discuss dual antiplatelet therapy, where 2 medications are combined for certain high-risk situations. It's like having a whole toolbox of options to choose from, and your doctor can help you pick the right tool for the job.
So it's about finding the right antiplatelet strategy based on individual needs and risk factors. It's a reminder that medical decisions should always be personalized and evidence-based. Now, we can't talk about stroke prevention without addressing the elephant in the room, age. How does the guideline handle age considerations?
Age is a significant factor in stroke risk, but the guideline emphasizes that stroke prevention is important at every stage of life, not just in our golden years. It's never too early or too late to start taking care of our brain health.
So it's about building healthy habits early on and maintaining them throughout our lives. What are some specific age-related recommendations from the guideline?
For older adults, especially those over 70, the guideline recommends careful consideration of aspirin use, as the risk of bleeding can outweigh the potential benefits. It's about finding that sweet spot where the benefits outweigh the risks. And for everyone, regardless of age, it stresses the importance of personalized risk assessment, taking into account overall health medication use and individual preferences.
It's about having those open and honest conversations with your doctor, weighing the pros and cons together, and making informed decisions. Now, before we wrap up, I want to circle back to something we touched on earlier, the prevention gap.
Hmm.
Can you remind our listeners what that is and why it matters?
The prevention gap highlights the difference between what we know about stroke prevention and what we actually do. It's like having a treasure map, but never setting sail to find the treasure.
So we have the knowledge and tools to prevent many strokes, but there are barriers that hinder our progress. What are some factors that contribute to this gap?
It's a complex issue with many contributing factors, from limited access to healthcare and healthy food options to socioeconomic disparities and even individual beliefs and behaviors. It's like a tangled web that we need to unravel strand by strand.
So closing the prevention gap requires not just individual effort, but also systemic changes and a commitment to addressing the root causes of health inequities.
Hmm.
It's about creating a society where everyone has the opportunity to live a long, healthy life, free from the threat of stroke.
Exactly. It's about building a world where stroke prevention is not a privilege, but a right.
Well said. As we conclude this deep dive into the 2024 guideline for the primary prevention of stroke, I'm left with a sense of hope and a renewed commitment to my own brain health. Remember, you have the power to reduce your risk of stroke significantly. Embrace life's essential 8, talk to your doctor, and be your own health advocate. And a final thank you to London Heartbeat Seed Academy in the UK for providing us with the material for this deep dive. And to all of you listening, thank you for joining us. If you found this deep dive helpful, please subscribe to our podcast on platforms like Facebook, Instagram, Spotify, and YouTube so you don't miss future episodes. We're always exploring fascinating topics like this one. Until next time, stay curious, stay informed, and stay healthy.